Okay, today we're going to talk about functional medicine. You really need to understand what functional medicine is to understand how we approach chronic conditions. Functional medicine actually addresses the underlying cause of disease using a systems-oriented approach that engages both the patient and the practitioner in a therapeutic partnership. We actually partner with you through the healing process. It is an evolution in the practice of healthcare that better addresses the healthcare needs of the 21st century. By shifting the traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person, not just an isolated set of symptoms. Every fibromyalgia patient is different, so the underlying cause and the aggravating factors and triggers are often different. Functional medicine practitioners do spend time with their patients, listening to their histories, and looking at the interaction among genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. Functional medicine actually supports the unique expression of health and vitality. It's important to understand that functional medicine is a personalized, systems-oriented model that empowers patients and practitioners to achieve the highest expression of health by working in collaboration with one another to address the underlying cause of disease. Functional medicine offers a powerful operating system and clinical model for assessment, treatment, and prevention of chronic diseases like fibromyalgia, to replace an outdated and ineffective acute care model carried forward from the 20th century. And that's why many of you have fallen between the cracks of modern medicine. Functional medicine incorporates the latest in genetic science, systems biology, and understanding of how environmental factors and lifestyle issues influence the emergence and progression of disease. Functional medicine enables a physician and other healthcare professionals to practice proactive, predictive, personalized medicine and empowers patients to take an active role in their own health. In functional medicine, the most important factors, and the ones that we examine first when we gather information about a patient, are the foundational lifestyle factors like sleep, exercise, nutrition, stress level, relationships, and of course, genetics. These are the foundational issues which are in turn influenced by specific predisposing factors, lifestyle issues or triggers, and ongoing physiological processes that may result in fundamental imbalances in the human body. These can eventually result in signs and symptoms that are grouped into a diagnosis called a disease, like fibromyalgia. Conventional medicine tends to look at the symptoms first, which usually results in a disease diagnosis. Often the diagnosis is associated with a drug or drugs that can be prescribed to treat a set of symptoms, and this is the end of the story. But this approach neglects the more fundamental aspects of health that reside in the very foundations of health. It treats all patients that present with similar symptoms with the same exact way, and it neglects their differences. And where fibromyalgia is concerned, this is big. I've told you that fibromyalgia is a multi-system breakdown, and everyone does not break down for the same reason or in the same order. Now, keep in mind that at the platinum level of this program, I work with fibromyalgia sufferers in partnership, just like I described, where I actually walk them through the process of recovery. In the gold level, I walk through the process of recovery in a group setting. In the free level, I do my very best to lay out functional medicine concepts, principles, forms, questionnaires, so you can implement these principles yourself. I am continually working on making every level of this program, this website, more effective and more helpful for those who are suffering from fibromyalgia. I hope that this has given you a good idea the difference between functional medicine and modern medicine. I'm going to share with you in the next video case studies that really do illustrate the difference in our approach. Thanks so much. Have a great day.